Thank you for attending Saebo's monthly product webinar. My name is Scott Thompson. I'm the Director of Clinical Services here at Saebo Incorporated, and I'm also a treating doctor of occupational therapy. I wanted to, again, thank you for joining us today. Hopefully the weather's nice wherever you're at in the world. And let's get started talking about the SaeboStim Go. As a therapist, before I even get started, I wish I had this product for many, many years with all the struggles we have with people using eStim. So I'm going to explain several things today on why it is so amazing and so simple. But first, I want to talk to you guys about a couple handouts. If you're on the webinar, I have attached a couple handouts. One is our Saebo Solutions PDF file, and that just is a picture. It'll be the third slide of all of our products, and so that you have it for review or you want to share it with somebody else. And I also attached the actual printable handout for this webinar with all of the slides, if you want to print that out and write something, or if you just want to have it for a later time. Okay, here we go. So these are three statistics that that I love to just talk about, because as a therapist, this is very irritating for me. So one study by Bernhardt in 2007 said that people that are 14 days or less after surviving a stroke use their arms 7% of a 9-hour day. So approximately 38 minutes. If you think about it, that's any movement that they possibly have. 7% of the day they use that arm. That is such a tiny amount of time. The second one here is a couple studies, and they said that within a normal therapy session, you get 23 to 32 repetitions with your arm. So if you think of a typical therapy session is 45 minutes to 60 minutes long, you're only having people do 2 repetitions a minute. So try doing that. Try not moving your arm that few amount of times in a minute. As soon as you start talking with your hands, you just did 10, 12 different repetitions. And then the last one on the right is, it says that in that same 45-minute or 60-minute session, you only get an average of 4 minutes of activity-related arm training. So 4 minutes of something that the person is supposed to be training on out of 60 minutes. Again, a dismal amount of repetitions. And for neurological recovery and for almost anything, it's all about the repetitions. The more that you do, the better the skill and better your ability is going to be. So here is the Saebo Solutions flyer that I attached that you can download. Let me just go through the products real quick. Up in the right corner is the Saebo glove. It's a low profile glove that you can essentially, if you have very limited movement of your hand, or if you have mild spasticity, it helps open and extend your fingers and thumbs so that you can grasp objects and be completely functional and use it throughout the day. The next one in the orange is the Saebo Flex and the Saebo Reach. The Saebo Flex has been around for many, many years. It's in textbooks. It's on the OT national test. It's being taught by professors. It's going into a museum as one of the top medical devices in the last 400 years. And truthfully, from a therapy standpoint, I have never seen a device that, after I put it on, somebody with an extremely tight fist that hasn't used their hand in years can automatically grasp and release. It's an amazing device that I really, really love, and I keep getting to know it better and better and use it more and more and more and more and more and more. And the Saebo Reach is the Saebo Flex with an above elbow component that helps extend the elbow. So now you're working on functional reach and extension and flexion of your elbows, etc. In the black, we have the Saebo Stretch. It's my favorite resting hand splint. It's great for keeping the bones and the soft tissue in perfect alignment, like it should be. People with spasticity, unfortunately, have tone that kicks in, and their fingers flex and their hand curls and all sorts of stuff. And this was designed with a flexible hand plate that stores the energy that they create when they actually perform a volitional movement, like standing up, sitting down, coughing, sneezing, anything like that, the hand and the fingers want to bend. Well, it allows them to bend, but then adds resistance. So as they relax or stop doing the movement, it pushes their hand back into a nice resting, safe position, avoiding soft tissue shortening and joint deformity of any sort. Next in the pink is the SaeboStim Micro. That's a sensory electrical stimulation unit, and essentially it has many, it works on tone and weakness and pain and edema and circulation, but it has 2 programs, one for the day that's only 30 minutes long, or my favorite is the nighttime one where you work on cortical priming while you sleep. It's like 3 hours of free therapy. You turn it on and you get 20 minutes of stimulation, or what we suggest is actually sub-stimulation. So you turn it up to where you just start to feel it and then turn it down 1 notch, and the research is showing that that's excellent for the sensory motor priming. So when you wake up in the morning, you're ready to go, and that limb is more awake, and that part of your brain is more awake and developed while you were sleeping. Great device. See positive feedback all the time on it. We have the SaeboStim Go in sort of the blue or in the aqua blue. Sorry if that's the wrong color, but I'm going to talk about that for the rest of this. We've got the Saebo Mirror Box, which is an adjunct to any therapy routine or home exercise program. The research shows that if you add it into whatever you're doing, unless it's nothing at all, it will help improve it will drastically improve your recovery. The SaeboStep is an out of the shoe or an external AFO. It wraps around your wrist. It uses a BOA dial, sort of like ski boots, snowboard boots, for tensioning and helping with foot drop. It also allows you to wear any shoe that you want. We've put it on sandals and flip-flops and all sorts of stuff like that, and it's pretty amazing. There's the Saebo MyoTrack Infinity that we have, and that is a clinical device for electrical stimulation, but it has a biofeedback program. It has electrical stimulation with so many parameters I can't even name them all. It has EMG trigger stimulation, so essentially it uses biofeedback and measuring the amount of contraction a person can produce, and you set a threshold for that person to overcome that threshold and create that strong of a contraction, and then it rewards them with an electrical stimulation to the muscle group they wanted to fire. And then also the reciprocal EMG trigger program. Essentially, you put it on the opposing muscle group that is causing spasticity or tone or resistance to movement, and you help the person volitionally learn to shut that off. So when they relax those spastic or tonal hypertonic muscles down to a certain threshold that you set, then it rewards the other muscles that you want to contract with the electrical stimulation unit. You have the Saebo VR in purple. That is the only ADL virtual reality game out there, and I see tons and tons of people enjoy this, using it every single day. You could do stuff like shopping and going to the grocery store and putting your clothes away and folding laundry and helping out in a soup kitchen and feeding yourself, etc. And also, if you remember those statistics, you only have 23 to 36 repetitions per session. Well, I've had somebody do just one activity and do 152 just a couple of weeks ago. 152 full functional reaches with an affected limb. It's pretty awesome. The next one in green is the Saebo Rejoice. It's another virtual reality gaming system, but it has what we call the manipulandum that works on different types of prehension or grasp patterns. So it has opening a jar and picking up coins and opening, turning the key or a doorknob and moving your wrists and your fingers in multiple different directions. And you do that repetitively to control these games. And while you're having fun and laughing, and most of the time spouses laugh at the when we make it really difficult. I shouldn't even say spouses, it's just they pick fun, or the most fun of the clients using it, but we all laugh at how fun and funny some of the stuff can be. And then the Saebo Mas, which is a mobile arm support that essentially creates a zero gravity system for the shoulder and the elbow, so that the person doesn't have to focus so much on it and can reduce the spasticity and the ataxic movements that come with struggling to move a limb and then allow them to do functional reaching and movement and increase their repetitions, et cetera, et cetera, et cetera. So back to the SaeboStim Go. We're going to close the gap. And we're going to play with those words because the gap is talking about shoulder subluxation and the gap between the shoulder blade and the arm bone or the humerus. It is a wearable, wireless stimulation device that was designed to help treat shoulder subluxation more efficiently and much easier. So it's going to help prevent and reduce the shoulder subluxation by weakening or by strengthening the weakened muscles and surrounding that surround the shoulder joint, essentially making it all fit back together like it should, instead of just stretching itself out. And for the therapist on the call, think about how many beds at your hospital are designated for neurological recovery. We know that a large percentage of those beds will have proximal weakness with muscle grades less than 3 out of 5. That means a person can't lift their arm against gravity up over their head. Now, I spoke with several groups of inpatient therapists and asked them, how many of you think that eStim is a meaningful solution for treating, maintaining, or reversing shoulder subluxation? All the therapists raised their hands, because that's truly the only way you can really treat the shoulder subluxation. You've got to strengthen the muscles of the shoulder joint. I then asked, keep your hands up if you currently have a shoulder subluxation eStim protocol at your hospital, and all the hands dropped. And they all dropped because the same reasons that people don't widely use eStim. The device is too expensive, nursing, the caregiver, the patient all struggle to figure out where the electrodes go, or don't have the time to set up the eStim unit. And then with tangled lead wires and having to safely store the eStim unit, it's just too complicated to feasibly use an eStim unit. And it's not just in the hospital setting, it can also be at home. For all these reasons, patients aren't recovering or are not recovering quicker in the shoulder. Even though therapy, nursing, physicians, etc., we all know that this is a vital component for reversing or minimizing subluxation. That's why we designed the SaeboStim Go, to increase patient recovery and get rid of all those reasons. Or some would call them excuses for not treating the shoulder. Now, for the non-medical people on this call, let me tell you a personal story. I had a family who loved the stroke survivor to death and waited on her hand and foot, hoping to get the recovery they all wanted. I spent 6 treatment sessions training family members, her spouse, and 3 different caregivers so that they all could demonstrate how to set up and use the eStim, and they did. I would say they were anywhere from 90 to 100% good following that. Well, guess what? Out of the 9 people I trained, 2 people attempted to use it once, and they all gave up. Those were 2 of the caregivers, the main caregivers. Now, though they all loved the stroke survivor, they just couldn't figure out how to use eStim, and sadly, the husband was a former OT, but the wife wouldn't let him perform eStim or any intervention on her, for that matter. Does that situation sound like, at least in the part that you had high hopes for using electrical stimulation, but just couldn't get it to work, or have avoided trying because it's intimidating? Well, we've created the SaeboStim Go to help make it as easy as possible to use eStim. And before I talk more about the SaeboStim Go, I'd like to share some statistics with you. The prevalence of shoulder subluxation was more than I expected when I started looking into research. So the first one is people post-stroke. Anywhere from 17 to 81% of people post-stroke suffer some type of shoulder subluxation during their recovery. If you look underneath that, people that were post-stroke that had a hemiplegic arm or a paralyzed arm, approximately 84% of them had shoulder subluxation. But it's not just limited to stroke or neurological diagnoses, but it is also common for athletes. So I found this 2018 research that said that 84.6% of sport-related shoulder instability from US military academy athletes, tip-top shape people, was caused by shoulder subluxation. That is a huge number. So As you just saw, subluxation is a common occurrence after stroke and is typically due to the loss of muscle tone and voluntary movement. Now, the reason is gravity pulls on your arm and stretches all the soft tissue and connective tissues, separating the arm bone from the shoulder socket. See the picture on the right? How the ball end of the humerus or the arm bone is not sitting in the joint nicely? That's what happens. Your arm literally drags and falls out, and it creates that gap. What's even worse is that it often occurs in flaccid arms by the 3rd week post-stroke. Now, the typical stroke survivor stays in acute care for possibly a week and then is transferred to inpatient therapy for about 2 more weeks. So by the end of inpatient therapy, if that arm is not moving, they have an extremely high chance of already having shoulder subluxation. Remember, 84%. Now, traditionally, theorists consider the supraspinatus muscle as one of the key electrode placement sites for treating shoulder subluxation. And people still teach this to this day. But the supraspinatus muscle is located in a groove on top of your shoulder blade, which makes sense. You would think a muscle on the top of the joint would pull the joint together. Well, it does. But the latest evidence shows that the supraspinatus is one of the weakest proximal migrators and is not as effective as once believed. So that bullet point is saying, it's talking about how well it pulls the arm and the humerus and the bone and everything together back into the joint. Now, the latest research shows that many stroke clients exhibit partial tears of supraspinatus tendons as well and have no symptoms, or at least don't show any symptoms yet. So do you think that it's smart to rely on a smaller torn muscle to perform heavy lifting of the arm? I think not. For best treatment of shoulder subluxation, and this is speaking specifically to therapists on this call or medical personnel, and to people who are in therapy right now or in the future, you want to tell them that the best treatment for shoulder subluxation is electrode placement over the deltoid muscle. They are the strongest proximal migrators of the shoulder joint. You even have bicep and tricep muscles that are better migrators before the supraspinatus. So let me tell you why I really enjoy this product. It's affordable, it's simple, and it's something that should have been invented a long time ago. You know, it's wireless, which is amazing. It's sleek, and it's lightweight. I wore one on each of my shoulders and went to the local big box home improvement store. Only one person asked about it because I was talking to him about his wheelchair and his backstory and how he got in. You know, he had polio and post-polio syndrome, etc. One person out of like an hour and a half trip to the store. It uses, well, let's just read off the slide. Superior quality reusable gel pad. It is, the gel pads are like the highest, are above the highest quality SaeboStim pads that I have ever used. Now, I've said that this was simple, but let me tell you what makes this device so simple. It only has one preset program. There's no having to select a program. There's no guessing which one's going to work the best. All you do is place it on, turn it on, and go. There's an intensity button that I push about 4 times to get almost any muscle contracted. We have it in 2 sizes, small and a large, and you have to do a measurement to decide which one you are. It's ultra thin. Rotating wing structures accommodate various placements. So to make that simple, because it's ultra thin and the wings actually bend, if you look, or pivot, if you look at the second picture or the picture on the bottom, it allows you to put it anywhere that you really want, whatever muscle group you want. And because it is flexible, it allows you to conform to the curves of the body as well. So if it works on Jimmy's shoulder and he is 5 times the size of Susie's shoulder, it's still going to conform to whatever curve Susie has. Another great thing is that on the underside of the blue wings, the entire surface has been coated with silver. and it creates an even electrical stimulation. So when you use normal e-stim pads, they usually sting or feel like pins and needles because the wing is completely covered by the silver coating. It creates no peaks or valleys and offers a more comfortable stimulation experience. I've used this on people who are extremely afraid of electrical stimulation because of pain from a prior experience, or even one of them had a burn. Not one person has ever had pain. In fact, most of them take a sigh of relief and giggle about their body moving like they want with no pain. I had one woman who was extremely anxious, and her friends convinced her, and I even let her friends turn it on and turn it up. And I mean, this woman was jumping out of her skin before we even turned the device on, and she was just laughing hysterically because it didn't hurt. She and I quote, "This is amazing. It doesn't hurt at all." Now, another one of the great features is that it has an extremely long battery life. The battery lasts, and it's rechargeable nonetheless. The battery lasts for 24 hours of stimulation. That's 24 cycles of stimulation before it needs to be charged. For me, I use it throughout the day, attach it to a computer, and when I'm finished using it that day, eh, I just plug it in. And then the next time I go to my computer, it's there, it's charged, ready to go. It's also can be extremely hygienic, which is a big issue for hospitals and clinics and treatment in general. You can just put a cleaner on a rag, wipe it down to clean it. And then to even make it better, we send a heavy duty Ziploc poly bag that you can also clean on the inside. But if you want to put it into the bag, whether at home or into a purse or in the hospital, you won't get any additional environmental stuff on it. I mean, imagine what's at the bottom of a purse. I've seen my wife clean out her purse. There's a lot of stuff at the bottom. So here's what it looks like up close. You have two parts. You have the white part, that's the controller, and it separates from the wings. And on the next slide, I'll show you how it connects. But if you hold the button with the Saebo logo for 3 seconds, it turns the device on and off. A blue light will illuminate inside the middle of the O, which means it's on. And then you just push the intensity control button above or below the logo to increase or decrease the intensity. And it runs for a full 60-second cycle. So it automatically shuts off. But if you want to shut it off in the middle, all you do is hold the button for 3 seconds again. The light goes out. You hear a auditory beep, and it shuts off, and you're done. Up in the left corner is showing you that it recharges using a USB cable. And since those are so popular now and so readily available, I mean, heck, there's electrical sockets in houses and hotels that have eStim plugs. It's really easy and convenient to charge the device. Now, on the left is a picture of the wings alone. Those two metal buttons in the middle are magnets and are how the controller attaches to the wings. Essentially, you just put it over there and click, they're connected, and snap, it's unconnected. On the right is a picture mentioning our replacement gel pads. You can buy gel pads 3 at a time or save money and buy them in bulk at 30 at a time. That's how I bought them for treatment purposes. Remember, you can use each pair of gel pads 10 to 12 times. So if you buy only 3 pairs of replacement pads, you will still get an additional 30 to 36 hours of stimulation before you need to purchase more. That's a day and a half of treatment time. So here is how you put the gel pads on. The gel pads come in packs and with like a perforation between the two wing or the two pads that you'll need per replacement. And you can see on the bottom picture, it has writing on one side and it says skin side. So what you do is you remove the thin plastic layer on the other side, line it up with the silver coated portion of the wing, press it on, good to go. Then you peel off the stuff that says skin side, the thicker plastic that's on there, so that you expose the stickiness of the gel pad, and you put it on your body on whatever the targeted muscle is. Right there, they're doing the finger flexors. And then the last thing is you turn it on and you go. It's that simple. That's why I love it. But like I said before, it's not just for shoulder stimulation or stimulation. It's not just for shoulder subluxation, but you can use it on other parts of your body. So if you look at the pictures here, we have it for the biceps and for the finger extensors while she's doing some fine motor work, moving the cubes. But here's a quick video from our YouTube page showing you different areas of the body you may want to put the SaeboStim Go. See, there you go. Pull off the plastic, put it on, you're good to go. Here we are putting it on the shoulder. I'll tell you, you don't have to move this slow or do this much work. I gave it to a lady and said, put it on your shoulder, and she just cupped it in her hand and slapped it on her shoulder. Turned it on, turned it up. That was it. 10 seconds of preparation. Here they are putting it on the finger extensors. You're seeing right there in real time, she pushed the button 4 times and her fingers and wrist extended. You pivot the wings a little bit, and look at that. Now you're set up to do finger flexors. You put them like Mickey Mouse ears, a little Disney reference there, in that position, and you can trigger your biceps. You straighten them out and put it on the back of your arm. Now you have triceps. But you know, there's other areas. I put it on my serratus anterior, on my rib cage underneath my armpit. I put it on my calf. I put it on my anterior tibialis for foot drop. I put it on glutes. I put it on my quads. You could use it for rotator cuff. That's what this is showing right now. That's the posterior rotator cuff, usually the ones that tear. So you can use it on multiple areas of the body, and it's just by pivoting the wings. But what's really cool is that because it's sleek and skinny like this and easy to set up, you can use it with other Saebo devices. So in the picture on the left, she's using it with the Saebo glove, working on fine motor tasks of grabbing those little 1-inch cubes, or 2-inch, I think they're 1-inch cubes, and it's helping extend her fingers and making her open her hand even farther than the Saebo glove would. On the right, I like to use eStim, and especially the SaeboStim Go, with the Saebo Stretch. So because then your hand or the person's hand is in optimal resting position, and then you can just fire the extensors trying to work on the motor cueing, or have them. I can sometimes undo the straps on the fingers, or even the MCP or dorsal strap over the top of the palm, to really get wrist extension, etc., but still stay in good bone alignment and not have to trigger spastic muscles in the finger flexors. And then you could do that while you're wearing your Saebo Stretch, which is really cool. But I know what you're thinking. This looks too perfect, right? White background, photos taken, etc. Well, to tell you the truth, it is that easy. Here are a couple real life examples of using the SaeboStim from a couple treatment recently. The person on the left is, he had a hemiparetic arm, and we were working on shoulder flexion, or lifting his arm up above gravity. So we put it on his shoulder, and then he's using the Saebo glide to go up and down. And we increased about 30 degrees in shoulder flexion in one treatment session using the eStim. The person on the right is using it on his anterior tibialis, like I said, for foot drop. What you might not see clearly is that he's actually wearing the SaeboStim as well. So he's combined the two to help lift his toes while he's stepping up onto those onto that platform. But what you don't know is that he actually has an e-stim on his shoulder underneath his shirt. That's why I was saying when I went to the big box home improvement store, I was wearing them underneath my shirt. And one person asked because I bent a certain way. They're very sleek and you can hide them. I mean, if this gentleman, didn't have his pants pulled up, you would not see the e-stim device. Now, for people like me and the medical professionals, here's the parameters that we're running. The waveform is a symmetrical biphasic waveform, which means it has 2 phases for every pulse and is extremely versatile compared to other types of waveforms. It also makes it suitable for long-term use, hence the 1-hour stimulation time before it shuts itself off. The pulse rate and width are exactly what research shows they should be for pulsing and muscle contraction. The on time and off time is 8 seconds, and that's a combination of many parameters. When you set up these programs on pre-programmed electrical stimulation devices, you'll get 5 seconds on, 5 seconds off, 10 seconds on, 5 seconds off, 5 seconds on, 10 seconds off, 20 on, 20 off, 20 on, 40 off, yada, yada, yada. Well, we found that if we use 8 seconds, we can essentially get 4 cycles per minute, which gives you a nice long electrical stimulation timing, but it's maximizing how many repetitions you can really get in a minute, but not fatiguing you. So it allows you to do more repetitions without exhausting your muscles from contracting it so often. So in an hour's time, in that cycle, you get 240 stimulation cycles, which is pretty good. It ramp up and down time is 2 seconds, so that means it's never going to just shock you full blast electricity. It always ramps up and ramps down. Like I said, the total treatment time is 60 minutes, and then there's maximum intensity is what you see there, and I'll tell you, it's got enough power to do a lot. I haven't had an issue. Now, I wanted to tell you guys about the clinical demoing. So we with every clinic demo, you get about 10 days to test it out in your clinic, and it could be patient products or it could be our clinical products. So again, I have that handout attached that is the Saebo solutions with all of our products. It was like the 3rd slide. Please refer to that or to our website, and if you're interested, call our local representative and request one of the demos, and we can ship you something for you to test trial it at your place. Here is for the people that aren't medical professionals, we offer a 30-day money back or risk-free trial. So essentially, you call your local rep, we ship you, or actually order online, and we ship you the device, and then you have 30 days to trial it. And for any reason whatsoever, if you want to return the device, it's 100% refund. So no risk, no hassle, it's guaranteed. So I just wanted to mention all of that stuff, and thank you all for coming out to learn about the SaeboStim Go. I'm telling you, I really love this device. I can see it being used in almost every rehab setting, and I could see it being used in almost every house because it's so simple. So let's take a little bit of time to answer some questions here. So first question, how do I send in my prescription to receive the e-stim? Well, that's pretty easy. Depending on where you're at, you need to call your local distributor, or here in the US, you need to contact our Saebo via, I think we can do it on Facebook. If you get on our website, there's a chat feature. You could call our 888 number, or if you already know who your local rep is because you or your local representative, or because you already have Saebo products, then you can just call their direct number or contact them via email. and then they can tell you the easiest way to get the prescription in. Now, I will tell you, it's not hard to get a prescription because I have worked in every rehab setting besides pediatrics, and all I do is talk to the physician and say, hey, like this person is going to need a script for SaeboStim. We need to get them set up for home exercise program. Blah, 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 blah. I've never had an issue getting a prescription for anything in the history of my career. It says, can you hand carry it on the plane? All right, so the next question is about taking it on the plane. I will tell you, recently I had a blood pressure cuff, a pulse oximeter, 2 electrical devices, and the SaeboStim Go devices in my bag. And I unloaded them, put them on the conveyor belt. It went through the x-ray screening and back into my bag. No issues whatsoever. Let's see. It says, can this be used in tandem with the Stay Mobile device? Well, I personally don't know. I don't use a Stay Mobile device. But if you think regular electrical stimulation can be used with the Stay Mobile device, then I would say yes, it could easily be used with that. However, always trial something out. If it doesn't work, it doesn't work, and there are money back guarantees. But because this thing's so versatile, I don't know if you'd ever want to return it. That's just me. I love this device. I have tons of them. Another one about, do I need a doctor's prescription? Yes, currently you need a doctor's prescription because the FDA, it's logged with the FDA requiring a prescription, but we're working on it being off the shelf, and that's sort of in the future. And then there's some questions, a bunch of people asking about how much it costs. Well, because we have several people from different parts of the world listening right now, I can't tell you what it costs because I don't have a cost list in front of me. And all you need to do is call and talk to your local representative or distributor, and they can give you what the cost is going to be. What else do we have here? Someone's asking, can we get extra long cables to increase the distance between 2 electrodes? Well, here's the thing, there are no cables. So I have used it on almost every major muscle that you would want to try to stimulate, and I have had no issue on me, and I'm 6'3", 200+ pounds. So if you can take that as the large wings fit someone my size, I'm not sure you're going to need extra wires. Now, if you do, you're probably going to have to use a different unit. This can't do everything. There's never a device that can do everything, but it is an extremely versatile and user-friendly device. I have a question here that says, can this device and others help 26 years post craniotomy for ruptured AVM and resulting left hemiparesis? The answer is, I am an optimist, and I never say that you can't get recovery. We even have someone who is a now personal distributor for Saebo products in another country who was 23 years post-stroke and used our Saebo products and had such a great recovery 23 years post-stroke that he is now owner and operator of a distribution company. I would say, yes, I have a feeling you're going to get some recovery. And again, you could call, by the way, if anybody has any questions past this, you can contact clinical support at saebo.com with your questions, and we'll get back to you probably within 48 hours. But those types of questions, very specific questions, you can talk to your local representatives, your distributors, or clinical support and get those answers specifically given to you. I have somebody asking about how much do the gel pads cost? Well, again, it depends on where everyone's residing in the world. So I can't give you what the gel pads are going to cost, but I will tell you that for this versatile of eStim device, it is extremely inexpensive. And if you go on our website in the US, there's actually the price for the US. Also, I believe it's on the Saebo Solutions flyer that I've posted. Another question, can you come to Saebo and try different devices to see what might be most helpful? Unfortunately, we do not have a mock area at the Saebo headquarters for people or swag purchases. So that's not how it works, but that's why we created the 30-day money-back guarantee or the clinic demo, because you can get it in your home, test it in the place where you're probably going to use the device, and keep it for 30 days to see if it's the device that you want, or it's going to benefit you. Are there any clinical trials using the SaeboStim Go to support your claims? Yes, there are a bunch of research trials going on right now, but because it is such a new product on the market, there's nothing in longitudinal studies or I've talked to several universities. Some of them, there were delays on the independent review boards, and that sometimes can take several months or even a quarter or two to actually get it approved because it's human testing, et cetera. So there were upwards of like 15 different large universities that wanted to do tests. I know of 5 of them right now that are running research on it. So hopefully we'll have that data coming up. But I will tell you, though I am a Saebo employee, I was not until earlier this year, and I have always loved Saebo products because they do exactly what they say. They are evidence-based products that always produce a result, and that's why I have used them for years and years and years. Are there any problems with electrode irritation with prolonged use? There always is going to be some type of irritation if you're a person that gets irritated by things. What I mean by that is it's specific to everybody. So most of the time, especially what a therapist would do, is if we use a device, we check your skin after every single use. What I would suggest is, use a device and then check your arm. There might be a little bit of redness just from blood circulation increasing in that area. Should go away in like 30 to 45 minutes. If it doesn't, then you might have an allergic reaction to the gel, but I've used it on several people and talked to clinicians across the world using this device, and we haven't had anybody talk about that yet. Will the product include a placement guide pamphlet for home program patients? The answer is yes. So it's not going to tell you need to do this every single day or twice a day or anything like that. That is what a therapist is for. We can't do that according to US law, but we did put all the different positioning pictures in there. So if you want to work a bicep or a tricep or whatever body parts you choose, there are pictures in there. Also, if you contact clinical support at Saebo.com, we can send you a resource that we use for electrode pad placements. An actual manufacturer of electrode pads has an entire database of videos on how to put electrode pads in the correct place for different body parts. So I personally have given that to the clinical support staff to use because it's a great resource that we didn't have here at Saebo. What are the contraindications? The contraindications are listed in our manual, and the manual can be found online on our website. They're the typical electrical stimulation ones. If you have irritation, don't use it. Always consult your physician if you're worried or have like some type of reaction. If you have a pacemaker, don't use it. Don't use it near computer monitors and electrical. People have smartwatches now. Don't use it around that because it can interfere with electrical signals. Especially don't use it, around like an EMG machine, just because of different waves coming from every which direction. But like I said, all the contraindications, too many to name. You need to check the manual that's online. Would it have any positive effect on the jaw or fingers? I would suggest not using it on the jaw. I think the pads are going to be too big for that area to start with. We haven't designed small ones yet, or I shouldn't say we did design small ones, but we haven't. The wings aren't designed extremely small to use in areas with that small of muscle group. Also, one of the contraindications is don't put it near or over your carotid artery because of what it can do in that area as well, and the reaction it can have with blood, etc. So with your fingers, you could use it for gross motor training. You can't, that's what we were showing you, the finger flexors, the finger extensors up on the forearm. I have reasonably sized hands, and I actually put the small wings in the same position as you would for the bicep in the Mickey Mouse position. And I put it on the thenar and hypothenar muscles, or the ones that control my thumb and the outside of my palm. And I was able to get opposition by doing that. But again, it depends on what size hands you have. So it's not going to hit very small muscle groups. It's going to hit larger muscle groups. Do you sell the extra gels? Yes, we sell the extra gel pads, and again, those are available on the shopping cart and in the distributors around the world. There was one about pediatrics. Does it fit people that are small or like teens or pediatrics? You're going to have to use the measurement form and the order form to figure out if it's correct for those people. It just depends on how big the person is. Like if you're trying to use it on a 3-year-old or a 4-year-old, probably not. Maybe a 5-year-old or someone who's a little bit larger and can tolerate STIM. But again, that's up to the therapist. The therapist's discretion to figure out if it's going to be appropriate. So that's about all the time we have today. I really appreciate everybody joining us, and I hope everyone has a great day. Remember, you can trial any of our products, as well as you can contact clinical support at Saebo.com to ask any further questions that you may have or I didn't answer. All right. Have a wonderful day and the rest of your week, as well as a great weekend. Thanks for joining us.